My name is Hunter Gauthier. I'm a student physical therapist. Today I'm going to be doing a tibialis anterior muscle manual test on my patient Miller here. We're going to be doing his left side because he has been having complaints of kicking the ground every time he tries to take a step, and he has to put an extra effort to raise at the hip. And so I'm going to be seeing if he is lacking any dorsiflexion strength and if that's the reason for his lack of foot clearance. All right, Miller, so today what I'm going to be doing is I'm going to be testing the strength of the front of your shin to be seeing if that's the reason why your foot isn't picking up off the ground. Does that sound good?
Yep.
All right, cool. So I have the patient sitting down with his hands bracing behind him on the table. I have a neutral thigh with a towel placed under his thigh, and then I have a towel down here for my own body mechanics. So Miller, I'm gonna have you do this motion for me. So I just did a passive range of motion to see his personal range of motion, and now I'm gonna have him do an active range of motion to see if he can do it against gravity. All right, go ahead and do that for me, please. Beautiful, and relax. All right, so I just checked his active range of motion. It's gonna be at least a 3 because he was able to do against gravity, and I was able to feel palpation of the muscle. So now, Miller, go ahead and come up into that position, a little bit more inversion, there we go. All right, so now as a physical therapist, I'm going to be applying a plantar flexion and inversion force. So I'm gonna be coming up a little bit more on the middle side. I'm gonna be bracing the back of his foot here so it doesn't move at all. All right, Miller, I'm gonna go ahead and start pushing down. Just go ahead and match my force the best that you can. All right, 3, 2, 1, push, 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 push. Beautiful. All right, so I'll grade Miller a 4 out of 5 because he gave just before the end of it, so he lost strength at maximal resistance. So I would document that finding as a left dorsiflexion MMT 4 out of 5. Common patient errors would be extension of the toes and then eversion of the foot to get more of a neutral line of pull for the dorsiflexion. Common PT errors would be bracing the wrong side of the foot, not bracing at all with the other hand, pushing just into plantar flexion and not inversion as well. Not having a pillow and knee is just right on the ground. Those will all be PT errors. And then so after this test, since he had a 4 out of 5 grading on the dorsiflexion MMT, I can rule that out for his lack of foot clearance. So next I'll go on to the hip flexion MMT and see if his bicep femoral short head is the reason why he's not getting proper foot clearance in his gait. And then before I did his left leg, I did check his right side to get a good baseline for his own capabilities. I'm Hunter Gauthier. I'm a student physical therapist. Today I'm going to be doing a long axis hip traction from the knee on my patient Miller today. He came in complaining about morning stiffness and pain throughout the day within the hip joint, kind of within the groin area in the medial and anterior side of his thigh. So I'm suspecting some hip osteoarthritis, and so I'm going to do this traction test to see if that relieves symptoms, and if it does, it could be an indicator of osteoarthritis. All right, Miller, so today I'm going to just be grabbing the lower part of your thigh, and I'm just going to be pulling you to see if that the lack of compression will help alleviate your symptoms in the thigh. Sound good?
Yep.
Awesome. So I have the patient laying down on the table supine. I have this mobilization belt strapped down, so just below the ASIS on both sides, so that when I try to distract that left femur from its joint, the pelvis doesn't come with it, or the rest of his body doesn't come with it, and I'll be able to get a true gauge on the mobilization at the hip. All right, Miller, so I'm just going to go ahead and bring your leg up here. I'm going to go into 30 degrees of hip flexion, 30 degrees of abduction, and slight external rotation. My hands are going to be on the distal aspect of the femur, hands posterior. My right foot is going to be slightly anterior, left foot slightly posterior to allow me to weight shift instead of just pulling. All right, so here we're just going to pull, weight shift, weight shift. All right, feel like relax. How's that?
Great.
Okay, so felt like normal mobilization, wasn't hypermobile or hypomobile. It was a firm capsular end feel. It wasn't soft, so no concerns there. It did alleviate his symptoms, so I'm going to assume osteoarthritis, but I'm going to do some other tests to check out. Some common PT errors would be pulling with just the arms and not weight shifting. Could be pulling too hard and having the whole body rock, and so we're not just focusing on the hip joint itself. One potential patient error could be muscle guarding around the hip, so making sure that the patient is nice and relaxed and not contracting any muscles around the hip to keep the femoral head within the acetabulum. And yeah, so I'm going to move on to other tests, but I am going to be suspecting osteoarthritis because that hip distraction did alleviate some of the symptoms. In the clinic, I would do the other side as well to see if there are any differences in size to get a good baseline. If he had osteoarthritis in the right hip, or if he was feeling osteoarthritic symptoms in the right hip, I would do both sides. But if he wasn't, I would still do the right side just to get a good idea of what a baseline mobilization feels like for Miller. Thank you.